Good afternoon. My name is Muhammad Sani, and for those of you who don't know me, I'm the program coordinator for the Kingston Immigration Partnership. And just a little bit about what we do. The Kingston Immigration Partnership is also known as KIP, and this is a community planning table and also a multi-sector partnership working to strengthen Kingston's capacity to welcome immigrants and improve integration outcomes through enhanced economic, social, political, and civic participation. KIP partners work collaboratively towards a welcoming, diverse, inclusive, and prosperous community in Kingston. I'd like to thank you all for joining us today to celebrate the start of this historic partnership between KCHC and the Kingston Police, titled Kingston Speaks, and that is Kingston Speaks Inclusion, and that is through community consultations and dialogue. And I think that really is weighted within the mandate of KIP itself, because KIP definitely does not exist without its partnership. So this new partnership between the Kingston Police and KCHC set the stage for a sustainable community, as I said, dialogue through community-wide consultations based on constructive conversations and honest feedback in ways that would allow us to build trusting relationships, especially between the police and our marginalized communities in Kingston. At this time, I'd like to invite Roger Romero, who is the manager for youth services and for the pathways to education at KCHC. And therefore, Roger is going to do both the land acknowledgement, but also provide some more context and background about this historic project. So please join me in inviting Roger to the stage. Welcome, Roger.
Good afternoon, members of the media and the Kingston community watching online. My name is Roger Romero, and I work with the Kingston Community Health Centers as a manager of youth services. I'd like to begin today's event by acknowledging that the work that we do at KCHC is situated on the traditional lands of the Anishinaabe Haudenosaunee peoples. We acknowledge their enduring presence on this land, as well as the presence of Métis, Inuit, and other First Nations from across Turtle Island. We honor their cultures and celebrate their commitment to this land from time immemorial. We are guests on this land. We acknowledge that this land is covered by the Upper Canada Treaties. My own personal reconciliation statement is that I need to listen, learn, and put my positive intentions into action. I will check my privilege when I can. Check my privilege, and when I can, I will use it to advocate for equity for Indigenous, Métis, and Inuit communities across Turtle Island. We are in community today to officially launch a new partnership between the Kingston Community Health Centers and Kingston Police, titled Kingston Speaks Inclusion. In order to walk a path of relationship and community, I had the honor of inviting grandmother Kathy Brandt to welcome our ceremony in a good way. Unfortunately, she was tied up with supporting a client in our sister site in Napanee, and she won't be able to make it today. So I just want to acknowledge that Grandmother Kate is a really important person in my life specifically. She brings a lot of knowledge and guidance to the work that we do. My role in this project will be to oversee a small team of KCHC staff who will be working in partnership with the Kingston Police. And as a tradition here at the Community Health Center, when I approach Grandmother Kate for knowledge, exchanging of knowledge, I do offer tobacco in a respectful way to encourage really great dialogue. So we ask that if you're attending today, that you come to this meeting with an open mind and an open heart. And if there's something that I did miss, please take it as I apologize, and that I want to make sure that we're all being here in a great place and a great mind. Thank you.
Thank you, Roger. I would like to now invite Constable Bryan Mcmillan. And Constable Mcmillan is the Equity, Diversity and Inclusion Officer for the Kingston Police under the auspices of a unit called the CORE, which really works with the community to promote community engagement in Kingston. Bryan, welcome.
Good afternoon. My name is Bryan Mcmillan, and I'm the Equity, Diversity, and Inclusion Officer with the Kingston Police. This is a new role within our organization, and I recognize that I am stepping into a position of enormous responsibility. I won't be long today, but I wanted to introduce myself and to say that my goal is to work to develop open and honest communication between the Kingston Police and the community. In many respects, I will be learning from our community members and relying on their feedback and input. Most importantly, I realize that I am a white, heterosexual male with tremendous privilege. In this new role, I will be thinking about what that privilege means and will be learning as much as I can about how underrepresented groups experience the police in Kingston. I look forward to working with our chief, our core unit, our board, and members of our community to make equity, diversity, inclusion, and indigenization a priority, and I look forward to learning and growing in this new role with guidance from our community. Thank you.
Thank you, Bryan. Next on the speakers list for today is Wendy Vike, who happens to also be my boss, and of course Mike as well. And Wendy is the Community Health Manager at Kingston Community Health Centers. And she's going to give you a little bit about our partnership with so many different groups and organizations, and in this case, of course, including the police. Wendy.
Thank you, Mohammed, and everyone else. And I should just let folks know that on my phone here we have Anita Jack Davies, who is working with the police, and she's out of the country, I believe, out of the country. So she's on the phone listening to today. So so welcome, Anita. Hi, everyone. I have the privilege of being the Director of Community Health here at KCHC, and I've been with KCHC now for 11 years, and I have to tell you how much I love my job because of the people I get to work with and the community in which we work. And I'm so grateful for partnerships such as this because I think it's really what makes Kingston a unique community, and I think we are well positioned for success in this area. Many of the programs I oversee are focused on the social determinants of health. So we know that people, if we focus on income and food and housing and primary care, people will live longer and be healthier and happier. With the social determinants of health, we focus on those, but we also focus here at KCHC on breaking the cycle of poverty. And while we have many programs that certainly go beyond this neighborhood and the Inner Harbor neighborhoods, some of the community health programs are very much directed at the Rideau Heights and Inner Harbor communities because the cycle of poverty there has been multi-generational. I'm so excited about this partnership, and I use the word excited, and I don't want it to sound like the connotation of that is too enthusiastic, but the reason I'm excited about this is because I feel like this can make a true difference for all of our residents in Kingston and these communities in particular. Throughout our community health programs, we hear lots and lots of stories from our clients and our families and our patients. And for many years now, those stories have been rooted in trauma that people have experienced and adverse childhood experiences and many, many barriers to being able to thrive and for people to be able to focus on good health and well-being. Some of those stories have included experiences people have had with the police. And the hope that I have right now is that this partnership will help us change the nature of those stories. When I think about our early on program, so you'll notice the sign on the banner and the rooms behind us here. That's a program for children aged birth to 6 and their parents and guardians to do play-based learning. If you were to talk to some of the parents in that program, and previously we had something called Better Beginnings for Kingston Children, if you talk to the parents in those programs, some of the stories they could tell you about their experiences with law enforcement could be quite upsetting. It's my hope that through this partnership and by engaging with our clients and patients and participants here at KCHC, that the children who are in the early on program now will be able to tell very different stories from those that some of their parents have told. Similarly, with our settlement services here at KCHC, our ISCA program, many of our clients and families and participants have had extremely traumatic experiences with law enforcement in other countries. My hope for our clients today is that the stories they will tell around law enforcement will be very different for them in their new home of Kingston and of Canada. When I think about the youth we serve with many of our programs, whether it's our sexual health clinic, our transgendered health clinic, or the Pathways to Education program, or our ISCA youth program, I'm often reminded of when we first started the Pathways to Education program in this neighborhood, where the pattern or the cycle that we discovered at that point was that young women often got pregnant at a very young age for the sake of having someone to love and someone to love them. And that young males often committed a crime for a badge of honor so that they could be included in some of the groups that their parents and guardians were involved in. When we launched Pathways to Education and our immigrant youth services, it really was about breaking that cycle, and we saw a really effective way of doing that was to keep kids in high school, and thankfully we've turned the graduation rate around and doubled it in this community. But a big part of that was our interaction with the police. And I remember, I think it was Roger's idea that very early on we said, well, if we were hearing from our students and parents that they didn't feel comfortable with the police and there was actually antagonism there, so we said, well, let's have a road hockey tournament. And sure enough, some officers just happened to be going by and came out and played road hockey, and that was the beginning of something new, I think, for youth in this neighborhood. And now we have the Police Athletic League, and the students are out playing basketball and sports with the police officers. And last summer we had a First Responders Day where we had youth playing soccer, and police officers and firefighters and paramedics came, and the interaction was so positive, and that's giving me hope that we can change the stories for those youth too. And I must say that it does make me feel so much better when I hear students in our programs talk about the fact that they want to go into law enforcement now. And when we started these programs 11 years ago, I don't think that ever would have happened. And in fact, I know there were parents who would have cringed if they'd heard their child say that. So I think things have started to change, and I think through this partnership, we can be part of even more powerful change. So I do have a very strong feeling of hope, and I'm very, very grateful to the Kingston Police for including us in this process. Thank you so much. And I'm also really grateful to Mike Bell, our CEO, and our board of directors to give us the opportunity to do this work. And but most importantly, though, I have to thank Roger for coming up with the idea and moving this forward and liaising with the police and just making this happen, because I think it's a game changer. So thank you and welcome, and I look forward to working with all of you.
Thank you, Wendy. I really think that the takeaways are hope, change, and constructive dialogue. I would also add that if you have not already noticed, I'm Black and also a Muslim, and I know how sensitive these kinds of conversations can be when you think about someone coming from my own background. But just like Wendy, I'm also working from the standpoint that hope is better than no hope at all. And that reaching out to every institution in our society to create a platform for dialogue, at the end of the day, I think is one of the many answers that we are looking for. And I believe strongly that we are doing this in good faith, both sides, and that KCHC happens to be the right place for this kind of partnership, because we work with all types of organizations, as I said, but also different stakeholders, including, as I said before, marginalized groups. And I think if dialogue at the end of the day leads to better understanding of how the Kingston Police could be in a better place to serve the communities that are out there agitating for more fair play, I think then ultimately that's one of the many ways we can approach this. I'm also very glad that this initiative has begun, and I think we can continue to build on it by bringing in more people and more voices that have not always been heard from when these conversations are taking place. And I suspect that that is really the intention of the Kingston Police, and we should be able to support them in this endeavor. Now, this was not supposed to be a long speech, but I was encouraged by what Wendy said, and I just wanted to build on that. You know, you have to always wait for that background to be set before you can be able to make any meaningful contribution in this conversation. I also have the honor now to invite Mike Bell, who is the CEO of KCHC, to offer his remarks. Mike, thank you.
Thank you, Mohammed. My name is Mike Bell. I have the honor and privilege of being the CEO of Kingston Community Health Centers. And thank you, Mohammed, for sharing some of your own thoughts and views on things. It's all about creating safe space to hear personal stories. I think that's what's really going to take us to the next level in Kingston and beyond. So it's wonderful to be here today to talk about this important initiative. KCHC is blessed to have a number of really valued partners, and our relationship with the Kingston Police is especially important. So thank you, Bryan, Chief McNeely, for the many ways in which you support KCHC and our clients and community. Given the mandate of KCHC and the work we do, I'd like to situate the conversation and topic within a broader public health and health equity lens. Too often we consider gaps in equity, diversity, inclusion, and indigenization as social problems, and they are, but they're also significant health policy problems when you consider the evidence is clear around health disparities among equity-seeking individuals, especially racialized people. For example, living in disadvantaged environments, living in poverty, working in public-facing jobs. These all play a role in creating a disadvantaged health status. And moreover, studies show that members of our community are more likely to be hospitalized for conditions that there's no reason to be hospitalized for, and ultimately have shorter life expectancy when you're marginalized in these ways. So, and these realities are particularly sad when you consider the policies which create them are socially constructed, unjust, and avoidable. And we're seeing it now when you look at where COVID has hit the hardest. Racialized and impoverished neighborhoods have the highest rates of COVID, and our systems are rarely designed to address the root causes of the inequity. So, improving the situation is up to all of us. It's up to KCHC, it's up to Kingston Police, and beyond. We need to examine our programs and services and ask, are they safe? Are they predictable? Are they available? A true commitment to engaging community members who are too often unheard or not asked is the only way we will get to the answers. So as we start to imagine a post-pandemic world, we're out here in person today, we have an opportunity. We can include equity, diversity, inclusion, and indigenization as a fundamental priority in our new landscape. This means listening, learning, creating a safe space for equity-seeking people to describe how our current systems and policies and norms need to change in order to serve them better. So this is what Kingston Police is doing. We applaud the commitment, and we know that both organizations are going to learn along the way. So I'd really like to thank you again for the opportunity to partner in this very important initiative, and we can't wait to see how much better we can make Kingston in the years to come. Thank you.
Thank you, Mike. Absolutely. I think, again, it's true engagement as we move forward with this partnership. And I think this is also a good segue for me to invite Chief Antje McNeely, who is the Chief of Police here in Kingston, to speak about the other side of this partnership and engagement. Chief McNeely.
Hi, Anita. I'm covering you up a little bit here. Thank you very much for attending today. And I'd like to, again, begin by a land acknowledgement as well. Sego, Ani, Buju, Wacheya, Kwekwe. As Chief of Police of the City of Kingston, I offer these words in the spirit of this gathering. Let us bring together our good minds and hearts together as one to honor and to celebrate these traditional lands as a gathering place of the original peoples and their ancestors who were entrusted to care for Mother Earth since time immemorial. It is with deep humility that we acknowledge and offer our gratitude for their contributions to this community, having respect for all as we share this space now and walk side by side in the future. Thank you for gathering today to mark the start of a new venture being initiated by the Kingston Police in partnership with the Kingston Community Health Centers, or KCHC, as they're more commonly known. We are pleased to be with all of you here. We've had the privilege of working with KCHC several times in the past. The goal of the specific partnership being launched today is to host a series of community-focused consultations on equity, diversity, inclusion, and indigenization. We believe that the topics of EDI and truth and reconciliation are timely, and we are committed to addressing each across the breadth of our organization in the weeks and months to come. Recent events have brought increasing awareness to the needs and to re-examine Canada's history and the legacy of residential schools. This is a painful time for Indigenous communities, and the Kingston Police would like to be allies in this healing process. However, we cannot be allies unless we critically reflect on our past and put a plan in place for our present and future that will be inclusive of the communities that we serve. These consultations will help the Kingston Police to learn more about Kingston residents through a dialogue focus on building and mending relationships. In particular, the Kingston Police will engage in critical reflections about our roles within the community itself. We recognize that we need to learn and grow in this area, and that this process begins by taking a look at what we are doing right, as well as the opportunities for growth in inclusive hiring practices, developing an inclusive organizational climate, educating our members, and engaging in strategic planning. We will work with the Kingston Police Services Board to make EDI and indigenization a priority for our service. I'm personally making a commitment today to taking action in partnership and dialogue with and direction from Indigenous communities. Our actions will also be highlighted those policies and practices that continue to harm Indigenous communities and all underrepresented communities in Kingston. Today we are embarking on a specific partnership with KCHC to support us with this ongoing project. So KCHC is a leader in our Kingston community and a trusted organization that has worked tirelessly to support equity-seeking groups. We are hoping to learn about the experiences of Kingston residents by tapping into KCHC's vast community network. We believe that this partnership will help us learn about the thoughts and concerns of Kingston residents in ways that we may not be able to if we were to do the work alone. To this end, we cannot underscore enough the important role of KCHC in playing a leading role in the consultation process. This is not the first time our two agencies have worked together, even though this will be our first formal partnership. We have worked with Kingston Immigrant Partnership, with Pathways to Education in the Police Athletic League, with the Community Response to Neighborhood Concerns Group, and with the Integrated Care Hub, which houses KCHC's Consumption Treatment Services program. We are also geographically close, as both our main offices are in Kingston's North End. We did consider hiring an external consultant, but quickly realized that KCHC already had established programs and services to support many of the groups of the underrepresented communities from which we sought feedback. And while consultants work on a project and then move on, KCHC is already here in our community and will continue to be here long after the specific project is completed. For all these reasons, this seems like a natural fit. In January of 2021, the Kingston Police partnered with Dr. Anita Jack Davies and relied on her expertise as a cross-cultural expert and founder of Mosaic Cross-Cultural Solutions and the Badges to Bridges law enforcement program to support us with our strategic planning on EDI. This past spring, Dr. Jack Davies led preliminary consultations with members of Kingston's Black community. These consultations provided me and my leadership team with invaluable information, which we used as a guiding point in the creation of this new partnership. This fall, KCHC will facilitate culturally responsive community consultations with equity-seeking and underrepresented populations, as well as all Kingston residents. Through this partnership, the Kingston Police are seeking to create a more inclusive dialogue between our organization and the wider community. Ultimately, this partnership will inform the creation of a Community Inclusion Council, a new advisory body that will bring together community members and law enforcement community in Kingston. Plans are underway for the council to be created in early of 2022, and I will provide more information to the community in the upcoming months. Again, community consultations will be hosted by KCHC starting this fall, and all residents are welcome to attend. Sessions will focus on EDI-related topics, as well as other topics, such as the use of body-worn cameras by uniformed police officers. These consultations will align with the specific goals set out in our 2019-2022 strategic plan, amongst other initiatives. As we embark on our prioritizing EDI and indigenization for our organization, I must also make public commitment to my own growth and to my development and my own knowledge. This is not an easy task. It sometimes feels overwhelming, uncomfortable, and daunting. However, as Chief of Police, I will not ask my members to do what I am unwilling to do myself. I recognize my privilege, and I hope that you will be the partners with me during this process. The Kingston Police will prioritize related objectives in the current and future strategic plans. However, we cannot do this alone. We are asking each person gathered here today, and those that are viewing this taping, to spread the word amongst the upcoming consultations with your networks, via social media, and by visiting our website. We are also urging Kingston residents to attend as many meetings as they can. Our goal is for all voices to be heard and for residents to have their say. Feedback from the consultations will support the development of more inclusive EDI policies, procedures, and practices, and this can only be done when we hear from our residents. Thank you for your support. I will now turn it over to KCHC to discuss specifics about the consultations.
Thank you, Chief McNeely, for providing us with a deeper understanding of what this partnership represents, as well as giving your renewed commitment to issues of diversity, inclusion, and indigeneity. And I think that it's good that the press is here today as the watchdog of our community, also to keep an eye on all of the different commitments that have been made here today. And I'm sure the idea is that these commitments are meant to be action-oriented, and that's really the nature of EDII. It starts with concepts, but the people that are affected with all of these different issues don't see these different ideas as concepts. They live all of the different challenges that come or don't come with diversity, inclusion, and indigeneity. And I think, once again, the Kingston Police really has come to the right place, because we all want to make sure that every voice counts. And that is really the essence of this partnership. I would like to also now invite once again Roger Romero to give us more understanding once again about the way forward. Roger, thank you.
Thank you, Mohammed. I just want to really echo the work that we do at Kingston Community Health Centers is always based on relationships. And when this partnership was created, I can't actually take all the credit for this partnership. It came from personal relationships within the community. We already started building a really great team between us at KCHC and the Kingston Police. And events like this can't happen with just one person taking the lead. So I do want to give a special thanks to Kate Archibald Cross and Steve Koopman, who are kind of doing the behind the scenes work today. But they're really great to work with, and that relationship is really strengthening. So I think this was going to be the best part of our project. So I'm here to conclude the event by providing a little bit of an overview of the next steps for this project, because I don't want you to think that we're just here talking about this and nothing's going to happen. I personally have a vested interest in this work. I came to Kingston as a refugee from El Salvador, and I lived in North End, specifically on Weller Ave. And for me, the relationships with the community and the Kingston Police was always something I wanted to work at. So I think one of the things what happened was, as my career progressed, I was able to define partnerships in that relationship piece again, right, where we were able to connect with people in a really great way. So I'm really excited for this partnership, and I will describe a few of the next steps. So our teams will spend July and August building relationships in the community. You will see our teams throughout the city as COVID restrictions permit. We also be reaching out directly to community groups to set up community consultations. So the consultations will be formal, and we'll do a call out to communities, but we also will use our relationships to make sure we get to hold of some of the community members that don't often get asked their opinion. You will see the launch of an EDI page on the Kingston Police's website. You will see a social media campaign outlining how to connect to this work. The fall and winter months will be spent consulting the community around issues pertaining to EDII and policing. KCHC and the Kingston Police are committed to engaging with diverse individuals and community groups in a safe and meaningful way. Our team will report back to the community in the spring of 2022. We are excited that the Kingston Police has invested resources into this partnership. Kingston Police is redirecting financial supports to KCHC to strengthen community-based initiatives. This innovative approach is a first step towards more formal partnerships between Kingston Police and the community as a whole. We are excited for what this project will bring, and we cannot do this work alone. So we look forward to hearing from you, and we're hoping that you can connect with us as much as we connect with you. I really appreciate your time, and I hope to speak to many people in the next coming year. And I'm very grateful and actually really humbled to be part of this project, and I look forward to working on it. Mohammed?
Thank you, Roger. And this pretty much brings to an end our event for the day. I want to thank everyone, starting with all of our speakers and the press and everyone else who is listening, including our own consultant who is on the phone right now, Dr. Anita. We want to thank you for all of your efforts in bringing this partnership to fruition. And I don't know if there are going to be any Q&As today, or would that be it? Yes? All right, so I'm going to say thank you once again, everyone, for being here. And I hope to see you another time. Thank you.